Good afternoon. I am Dr. Vaishnavi. Can I know your name, please?
Hi doctor, my name is Meenakshi.
Hi, Meenakshi. Meenakshi, today I am going to examine your nose, mouth, and neck. Shall we proceed, Meenakshi?
Yes doctor.
Thank you. We are going to do the nose examination. So, in nose examination, you just check the anterior and inferior surfaces of the nose and check the tip of the nose and see is there any asymmetry you can find there. Okay, after that you just check for obstruction by pressing the nasae on the both sides, and during this ask the patient to breathe. Meenakshi, can you please breathe in so you can feel is there any obstruction there. Okay na? Now tilt the head back slightly by pressing the tip of the nose. And now with a good light just check the vestibules of the nose. And now to inspect the nasal passage, take the speculum which is long, and now insert it gently into the nose of the patient, and you hold it to a side so that patient's chin will not obstruct and that it will be easy for flexibility. Check the both nasal passages and check for is there any um, exudations or ulcerations. Repeat the same thing on the other side of the nose and check the nasal septum. Is there any ulcers or any exudations? And while examining, you should be careful that the speculum should not hurt the sensitive nasal septum. Note the color and condition of the nasal mucosa and check for is there any deviation in the nasal septum and any perforations and ulcerations on the nasal septum.
After examination, dispose the speculum carefully outside.
Conclude your examination by pressing or palpating the frontal and maxillary sinuses. First, palpate the frontal sinuses below the bony ridges of the brows without hurting the eyes, and then palpate the maxillary sinuses. Now we are going to do mouth examination. Before proceeding to the mouth examination, ask the patient to remove the lipstick which they apply to their lips. Meenakshi, can you please remove the lipstick if you apply? Okay, Meenakshi, shall we proceed?
Yes doctor.
Now examine the outer surface of the lips for symmetry, color and moisture. Note any lumps, crackling and scalings of the lips. First, going to the mouth examination, ask the patient to open the mouth wide. Meenakshi, please open your mouth wide. Now, examine the mucosa of the mouth and check for any ulcerations and color of the mucosa. And now, after this, check the margins of the gums. Check the margins of the gums for any swelling. And now, check for the interdental papillae for swelling or the ulcerations. After that, check the teeth of the patient carefully and find if there is any teeth is missing or discolored, deformed or disshaped, and Untreated caries leads to bacteremia. Now with gloved thumb and index finger, check if any teeth is loosened, which may lead to risk of aspiration in adults. And now check for the color and the architecture of the hard palate. Ask the patient to say ah, open the mouth wide. Meenakshi, open the mouth wide and tongue out. Now examine the soft palate and uvula and check for the symmetry. And when you examine, the soft palate should rest symmetrically on either side and uvula should be at the center. If the patient tongue is obstructing you for the examination, use the tongue depressor to depress the tongue and examine. But please be careful that it should not cause gagging of the patient when you are depressing the tongue. Inspect the anterior and posterior pillars or tonsils and pharynx for the redness, any exudations or ulcerations. None should be present. Now ask the patient to open the mouth and stick the tongue right up. Stick the tongue right up and first look for the color and the symmetry of the tongue. And then palpate the dorsal surface of the tongue, which is covered by papillae, sometimes a white coat. Now continue the examination by using a gauze pad. Grab the tip of the tongue, move the tongue to left side, and then examine the back side of the tongue at the sides and check for any whiteness or redness or any ulcerations below the tongue. And now after that, with your right gloved hand, palpate the tongue for any indurations. Okay, was the same process on the other side of the tongue. To begin the examination of the neck, first stand in front of the patient and look for symmetry and look for any masses, swellings, or any scars on the neck. After that, palpate the parotid glands and submandibular glands. Now, check for the anterior cervical chain. Palpate the anterior cervical chain. Now, just move the skin on the under overlying tissue slightly to feel them properly. Now, palpate the lymph node using the palms of your index and middle fingers. While palpating, just move the skin overlying the tissues or lymph nodes slightly. And now, inspect superficial cervical and deep cervical and supraclavicular lymph nodes, which are present anterior to the sternocleidomastoid muscle. Now note the size, shape, delimitation, consistency, and tenderness of the lymph nodes which you palpated. Now, feel for preauricular, periauricular, and occipital, and then tonsillar, now submandibular, submental, superficial cervical, and deep cervical lymph nodes. Now palpate the posterior cervical chain along the anterior edge of the trapezius muscle and the posterior edge of the sternocleidomastoid muscle. From here, like this, the path of the lymph nodes. Now, when you are examining the trachea, first look at the trachea for any asymmetry and then any deviation. First, palpate the trachea. Place the fingers on side of the trachea and feel the space between the trachea and sternocleidomastoid muscles. So when you feel on the both sides, the space should be symmetrical. Now, going to examine the thyroid gland. Whenever you examine the thyroid gland, first do visual examination from front, then examine from behind. First of all, ask the patient to tilt the head back slightly and now look for any swelling in this region of the thyroid gland. And now look for the cricoid cartilage and examine the area below the cricoid cartilage. And now with tangential lighting, find the lower shadowed border of the thyroid gland. So after this, again ask the patient to tilt head little back, neck little back, and now give a sip of water to the patient. Meenakshi, please take a sip of water, just a sip of water. So, when patient is swallowing, see the movement of thyroid gland. When the patient is swallowing, the thyroid gland moves upwards. So, along the thyroid gland, thyroid cartilage and cricoid cartilage also moves upward. After that, then they will fall down to their normal positions. So, note the counter and symmetry when patient is swallowing the sip of the water. Now confirm your visual examination by palpating the thyroid gland. Find the isthmus which usually overlies second, third, fourth tracheal rings and then palpate the right and left lobe. As you stand in front of the patient, look for any enlargement or goiter. Now move behind the patient and place the fingers of your both hands on the neck of the patient. Make sure that your index finger should be below the cricoid cartilage. And now ask the patient to take a sip of water and swallow. Now when patient is swallowing the water, you will feel the thyroid isthmus is raising behind your fingers. So now after that, slightly displace the trachea of the patient to the right side carefully. Now palpate the right lobe of the thyroid with your right hand between the space of displaced trachea and relaxed sternocleidomastoid muscle. Now palpate the right lobe. Here you can see like a small bulge. So repeat this process as it is on the other side and palpate for the other lobe. And check any tenderness or swelling. Now if you find the thyroid gland is enlarged, listen over the lobes. For breaths, with sounds which are very similar to the cardiac murmurs but are not of cardiac origin. This is commonly seen in thyrotoxicosis.